You may be wondering, is it autism or just a speech delay? I'm Dr. Mary Barbera. I've been in the autism space for over 25 years. First, as a very confused, overwhelmed mom, when my firstborn son, Lucas, started showing signs of a speech delay, and then autism. I now help parents and professionals really get started because it doesn't really matter if it's autism or just a speech delay. I'm going to tell you what you can do to take action to start to turn things around starting today. So, first things first, many toddlers have speech delays, and sometimes those speech delays are signs of something bigger like autism or maybe signs of ADHD. There are currently very long waiting lists for an evaluation for autism. A lot of people tell me they're 9 months to 2 years, and that really is heartbreaking. One of the reasons that I have done all my work, I have 2 online courses. One of my online courses is for parents of toddlers and preschoolers and early intervention professionals who want to help kids with autism, but 50% of the members in that toddler course do not have an autism diagnosis. It is just a speech delay, at least when they start. So I really want to encourage you to check out the online courses, and also my book. Chapter 2 of my book has some signs of potential autism as well. So, as I said, Lucas had a speech delay, but he also went to typical toddler preschool when he was little. When he was 2 years old, he went without a shadow, without a therapist. He did okay. He was just kind of a quiet kid that didn't care about toys. So it doesn't have to look really like severe autism for you to take action. And I really urge you to take action because there's a lot you can do. So one of the things, how I tell, if you brought me an 18-month or 2-year-old and you said, I'm worried about autism, here's the things I would look at. Now, as a registered nurse, a behavior analyst with a PhD, I cannot actually diagnose autism, but I have been trained in some valid tools such as the MChat, the ADOS, the STAT test. These are all tests that can just help determine if a child has autism or not. But some of the things I would look for if you brought your 18-month-old or 2-year-old to my house is I would look at, first and foremost, pointing. By 18 months of age, children should be pointing, not just once a month. They should be pointing a fair amount throughout the day. And by 2, they definitely should be pointing and developing language, putting a couple words together, talking, 50, 100 words. But even speech delay kids should be pointing. They should be pointing with their index finger, not with an open hand, and they should be pointing to indicate what they want, a cookie versus a cracker, but they also should be pointing to show you things like an airplane in the sky or bringing things to you to show you. This is really important. That will develop naturally in kids without autism. And by 18 months or 2, you should be seeing a lot of pointing and showing. The other thing I would look at is imitation skills. Children learn through imitation. They learn language and play and all of their skills through imitation. And kids with autism tend not to imitate very well. I would also look at their understanding of language, not just what they're saying. Kids who are very quiet and speech delayed, they should be able to touch body parts on command by 18 months and by 2. They should be able to follow simple directions. Go get your shoes, throw this in the trash, those sorts of directions. And they should not have excessive tantrums when going from one activity to another. This can be, a language delay can cause communication frustration, that sort of thing. But if you have a child who's excessively tantruming, who's not understanding language, not using language, not imitating, that is more likely to be autism versus not autism. The other thing that I learned as I was writing my book, Turn Autism Around, is that being a picky eater and having feeding issues is actually one of the diagnostic factors of autism. So if you have a child who's not eating well, is not sleeping well, this could also go into a possible sign. Another big sign that maybe people don't talk about enough is loss of skills. If a child used to do sing-songy things, used to talk, but now doesn't, or used to imitate, but doesn't, used to wave, but now doesn't, this is an area to be concerned about. So the things you can do if you're worried about autism or speech delay, or you can do a few things. Number one is you can watch more of my videos where I talk about the CDC milestones for every age. You can search CDC Act Early website for a 15-month-old, 18-month-old, 24-month-old, and you can see what they should be doing, not just in terms of verbal language, but understanding, cognitive skills, physical skills, drinking out of an open cup, drinking out of a straw, eating with a spoon. These all are 18-month skills that should be intact. If they're not, it could be autism, it could be something else, but I would get it evaluated. So learn the CDC milestones, learn what to look for and to see if your child is delayed in those areas. Number two, I would make a sick appointment with your pediatrician, talk to the daycare provider if your child goes to daycare or preschool, see if they're showing delays there. And number three, I was learn all you can about the child-friendly Turn Autism Around approach. The subtitle for my book is an action guide for parents of young children with early signs of autism. You don't have to wait 9 months to 2 years to get a diagnosis. Your child may never be diagnosed, but you can learn how to increase talking, decrease tantrums, improve picky eating, sleeping, potty training, going to the doctor's, dentist, haircuts without a fuss. All of this information can really be used for any child with any kind of delays or no delays at all, because it's all child friendly. So I encourage you to check out all of my resources and to attend a free online workshop at marybarbera.com/workshop. And I hope to see you in my course and community sometime soon.